One more time. Good morning. There, that's what we like to hear. My name is Daryl Richard. I am the Vice President of Marketing and Communications here at Quinnipiac University. I am certainly grateful to everyone coming out today to join us. I know we have some very exciting news to share that I think is going to have a really positive impact throughout the state and frankly beyond the state of Connecticut. We have a brief program. You'll hear from President Julian here from Quinnipiac University. She'll be followed by the CEO of Hartford HealthCare, Jeff Flax. And then you hear from one of our nursing students, Julian Chung. She's a senior nursing student, talking a little bit about what her personal story is, both through education and then her career journey beyond Quinnipiac. Then we'll have a brief ceremonial signing of what we're going to be speaking about today, and then certainly open up for any questions from the group. So without further ado, let me pass it along and first introduce the president of Quinnipiac University, Julian.
Well, good morning, everyone. Thank you, Daryl. Welcome to Quinnipiac University, home of the #1 men's ice hockey team in the nation. number four women's ice hockey team in the nation. And home to our schools of medicine, nursing, and health sciences. And I want to first thank Jeff Flax and so many of the Hartford HealthCare team that have come here today and have made this possible today. And of course, our team here at Quinnipiac University. This has really been a labor of love, of partnership. Now, we're standing in a relatively unique place. Very few universities have all of these schools of health sciences under one roof, as we have here today. And that's important because it fosters an environment for interdisciplinary learning and a physical connectedness and collaboration among our students. And they are learning in this coordinated environment how to be future healthcare professionals in an environment that reflects how healthcare operates today or should operate today. Doctors, nurses, physicians' assistants, imaging techs, occupational therapists, physical therapists, so many others. They're all trained and working alongside each other to deliver the best patient care and to advance healthcare access and equity. And that's the shared outlook that brought our organizations together here today to announce a landmark strategic partnership between Quinnipiac University and Hartford HealthCare. It's a partnership that's built on building the healthcare workforce of tomorrow and improving healthcare equity and access for all communities. It's a partnership that will enhance the distinctiveness of Quinnipiac's academics. It'll promote the health and well-being of our university. And it's a partnership that will greatly expand experiential learning and open up a host of new job opportunities for our students across all disciplines beyond just healthcare. This is a university-wide collaboration that's based on a strategic vision that brings together, on the one hand, a comprehensive university, and on the other, a comprehensive healthcare partner. Now, our two organizations are collaborating around 3 core areas. The first is providing high-quality, coordinated care to students through our on-campus healthcare services. The second is redefining and advancing healthcare education. And a third, and a very important purpose here, is developing and growing the state's workforce pipeline. Now, let me just briefly touch on these 3 areas before turning it over to Jeff. First, Hartford HealthCare will help us expand the high-quality, coordinated healthcare we offer our students here on campus. We're seeing already, or we were seeing, a significant increase in demand for on-campus healthcare services even before the pandemic, and COVID has only accelerated those needs. Quinnipiac will partner with Hartford HealthCare's Campus Care program to manage the complete care needs of our more than 9,000 students, from their physical health and mental well-being to the athletic training needs of our 470 Division I student athletes. This transition will happen over this summer as we prepare to open the doors of our 60,000 square foot new recreation and wellness center, which is currently under construction on the Mount Carmel campus. That'll be the new home for our on-campus healthcare clinics, and it'll be managed by Hartford HealthCare. The second purpose here of our partnership, Quinnipiac is already very fortunate that it enjoys vibrant relationships with many healthcare organizations across the state that offer Quinnipiac students valuable hands-on training and learning experiences. And in turn, these healthcare systems have access to some of the brightest, newly trained professionals in healthcare from across many of our programs here at Quinnipiac. Those relationships will continue, and we hope that they'll expand in new directions. The diversity of those clinical partners is core to our healthcare programs. Now, working with Hartford HealthCare, we will build on that vital foundation and do so in a way that'll be transformative for healthcare education. For example, Hartford HealthCare will partner with our Quinnipiac Netter School of Medicine on both undergraduate and graduate medical education to ensure that our students are trained in the latest treatment protocols, medical and technological advancements, and holistic patient care, which is a hallmark of the Netter School of Medicine. We'll work together to expand the pipeline of nurses, a job that is in such dire demand across the state and the nation. And the Governor's Workforce Council that both Jeff and I are on, in 2020 reported an annual need for 3,000 RNs just in this state. Now, with the support and engagement of Hartford HealthCare, we'll expand the clinical rotations available to our health sciences students, like occupational therapy, physical therapy, physician's assistance programs, and also the specialty rotations experienced by our medical students in areas such as family medicine or orthopedics or psychiatry. Partnering with an integrated healthcare system like Hartford HealthCare will help Quinnipiac grow the size of our various health programs to address these huge talent needs and gaps in Connecticut and beyond. And our students are interested in healthcare careers. They're attracted to what is very purpose-driven professions. Just as an example, this past year, our Netter School of Medicine received 9,200 applications for 95 slots. Imagine. And third, this partnership together, we will intentionally design a partnership that addresses not only healthcare's workforce needs, but also workforce and student pipelines in other high-demand fields. Quinnipiac is an unusually comprehensive university with graduates who have been very successful. We combine the foundational strengths of the arts and sciences and humanities with market-driven professional programs that our students emerge not just cognitively ready, but career-ready in a variety of fields. One of the few universities in the country, in fact, less than 3%, that have schools of medicine, business, law, and engineering all in one university. And Quinnipiac leads the nation, #1 in the nation, in employment successes of our graduates 10 years post-graduation, according to Zippia. This Hartford HealthCare partnership will further strengthen our graduates' career readiness and will position our students for a wide range of careers across the spectrum of positions at Hartford HealthCare, in healthcare and in many other fields. For example, Hartford HealthCare will offer internships, research, and capstone opportunities for undergraduate and graduate programs in fields across our 8 professional schools in the College of Arts and Sciences, like in supply chain management and logistics, computing, data analytics, accounting and finance, marketing and communications, biomechanical engineering, law, and compliance. A partnership will also offer and encourage upskilling and lifelong learning for those already employed by Hartford HealthCare, ensuring that our state's workforce is staying abreast of the changes in market demands and business needs. An example, Quinnipiac School of Business is already working with Hartford HealthCare on creating a leadership program to develop Hartford HealthCare's future leaders, from individual contributors to senior executives to their physician leaders. That's the type of ambitious, collaborative, transformative innovation that should happen when higher education partners with other major employers working together to solve real needs, to innovate, and to better our communities. So I now turn it over with great pleasure and admiration to Jeff Lax, the CEO of Hartford HealthCare, who along with his entire team at Hartford HealthCare has been so thoughtful, collaborative, creative, and transparent. This has been a true partnership already, working with us to build this landmark strategic alliance. Welcome, Jeff.
Thank you so much, Judy, President Olin. We couldn't be more excited to be here today. If the men's hockey team could be #1 in the country, if the women's hockey team could be the 4th-ranked team in the country, who can only imagine what this partnership could ultimately create? Right? There's so much enthusiasm here at Quinnipiac, and there's so much energy in the room today. This is a wonderful day. This is a day, throughout this crisis of COVID, I've said so many times that in healthcare, in aspects of our lives, we want to go back to normal. We yearn to go back to normal. But in healthcare, we have to be better than normal. We already are better than normal. And it's a partnership like this that leverages everything we've learned throughout this crisis and the needs and the mandates for improvements within healthcare and the need to build our workforce and strengthen our capacity here in Connecticut. It's innovative partnerships like this that will make us truly better as we go forward. Judy, I have to thank you in building this partnership. The vision that you've brought to this university and specifically to health sciences, your disruptive thinking, your focus on innovation, and your willingness to work to solve historic challenges with new and creative ways to make things better and to improve upon them is completely aligned with our point of view and our vision for the future of healthcare in Connecticut. We're so excited to be bringing together 2 historic Connecticut institutions and aligning our resources, our capabilities to create something that's new and better. This is a day that we really look to celebrate and recognize because we're making an important investment in Quinnipiac University. We'll be investing $5 million over the next 5 years, so $1 million a year, to really address the need to build our workforce pipeline so that we have the right numbers of people, the right level of quality and training and credentials in the future to care for all the residents in the state of Connecticut. And this is a critical effort for us to go forward. Just 2 statistics which help, I think, bring more attention to why this is so important. Today in the United States, there's an estimate by 2030 that we need 1.2 million registered nurses to be trained. Right, so we have to figure out ways to dramatically expand our capacity to train more nurses. The American Medical College predicts a shortage of physicians over the next, by 2034, of 124,000 physicians. So we have to create more creative approaches to train more nurses, to train more physicians, to train everyone within health sciences so we can meet the needs of Connecticut in the future and beyond. And we're working together to create the pipeline for this workforce in the future. I mean, this is a transformative effort. And what I'm so excited about is the way that we're going to create more scholarships, more fellowships, more residencies, more physician and clinical fellowships, more ways to train more people, to use experiential learning within Hartford HealthCare, to make Hartford HealthCare truly a learning laboratory, and our deep commitment to academia, to research, to innovation. We're going to be creating residencies in family practice, so we have more people to care for people in primary care so that we can dramatically improve access. So there's going to be far shorter times to wait to see physicians, to get physicals, to have care truly coordinated and managed. We're going to create more psychiatrists through our new training programs in behavioral health. So we have more people to help us address the absolutely essential needs within our communities around behavioral health. We're going to dramatically improve the size and scope of the surgical training programs to train more surgeons. We're going to create new training programs in things like orthopedics so that we have the right specialties here in Connecticut and so that we can improve access to care for everyone we serve. We're going to create new pathways, new and better ways to accelerate training so that we can ensure that our workforce is well credentialed, well prepared to serve us in these moments that matter most. And we're going to work with Quinnipiac to partner to ensure that we retain more students who are trained here in Connecticut. And that is at the heart of what this partnership is. We're going to use creative approaches that we're going to be hiring Quinnipiac students during their sophomore and junior years as they're in the academic programs so that they can be getting on-the-job training in our facilities so that they can learn more and faster and more effectively as they return back to their academic environment for their didactic learning opportunities. And so that we can ultimately create these pathways that when they complete and graduate, we have immediate job offerings for them, that they're on a pathway working towards so that they can seamlessly and smoothly enter our workforces here in Connecticut. This is exactly the type of innovation we need to build the workforce, that workforce pipeline for the future for health sciences here in Connecticut. We're going to be doing things together. Hartford HealthCare, we're going to be making investments, financial investments, in identifying, recruiting, and attracting students to Quinnipiac from minority and underrepresented populations who will have Hartford HealthCare-backed scholarships so that they can enter Quinnipiac, they can receive their academic training, receive their experiential learning within our facilities, and move immediately and smoothly into employment. That's the type of innovation that is being stimulated in this partnership. We're going to be leveraging our nationally recognized Center for Education, Simulation, and Innovation in Hartford, and we're going to bring technology, curriculum, and faculty from our world-class environment here to the campus at Quinnipiac and invest in helping build and enhance their Center for Innovation, which we will collectively build, oversee, and ensure that this university, the Quinnipiac, has the best possible capabilities to train their students in our future workforce. We're going to be working together to create new programs like pre-hospital training programs so that emergency medical technicians can be trained here on the campus at Quinnipiac and at the same time have those experiential learning opportunities in our facilities. You know, as President Olian mentioned, it's so much more than even healthcare. You know, this building, this facility, it's really amongst a few in the country. Quinnipiac is uniquely positioned because of the strategy to build an exceptional medical school, the Netter School of Medicine, to have an exceptional school of nursing, and to have a whole series of health sciences programs here in one roof, and students progressing through the process together in a highly coordinated fashion. That's the future of healthcare. How many times have I said healthcare is a team sport, right? And this type of campus, this environment, training the students together is precisely what we need when they enter our workforce to dramatically improve access, to improve quality, to help really become transformed around health equity and excellence. So this is a moment where the law students will work within Hartford HealthCare, where people studying human resources will work within Hartford HealthCare, people studying communications, information technology, biomedical fields. We're going to use all of our collective resources to train more people faster, expand the training programs, and ultimately smoothly transition them in the workforce to meet these critical anticipated workforce shortages so that everyone in the state of Connecticut has access to world-class healthcare. So we couldn't be more excited. This is a wonderful moment, and I often describe it, and President Olin will say this, it's just the beginning. Because together with our imaginative cultures, our shared interest in innovation, our collective commitment to asking not only why, but why not, we're going to do great things together. This is going to be a great partnership, and it's building on a historic relationship, and these two historic institutions together will create more, and more opportunities and more for the state. So today we have with us a student here at Quinnipiac, student Julian Chung, who's with us. And Julian Chung is a wonderful example of everything we're working towards, everything we believe in, why we exist. Julian Chung worked 2 years while she was a student here at Quinnipiac at the Hartford HealthCare Bone and Joint Institute in Hartford, right? One of the country's great bone and joint institutes, and amongst really one of the very few independent orthopedic hospitals in the country. An amazing innovation we created 7 or 8 years ago. Julian Chung's been learning in the Bone and Joint Institute and then created a fellowship that we have in Hartford HealthCare and Nursing, and is today approaching graduation in nursing here on campus in this building at Quinnipiac. This is the type of pathways we're going to make better. And people like Julian are not going to be the exception, they're going to be the rule. Because in a structured, specific, and deliberate manner, we're going to ensure that all students who come to Quinnipiac have these experiences, these opportunities, so when they graduate this great university here in Connecticut, they have great opportunities within facilities like ours or within other health systems throughout Connecticut who together partner to support this ecosystem within Quinnipiac University. So Julian, I'm so grateful for you. We need you. We need you in Connecticut, all of us do, and we need more students like you, graduated, who are from Connecticut. Julian's from Glastonbury, and who are committed to being in Connecticut and helping build world-class healthcare. Julian, please come forward. Thank you so much.
Hi, everyone. So my name is Julian Chung. I'm currently a senior nursing student. I'm approaching my last semester in the School of Nursing, which is bittersweet. I won't be at the university with the #1 men's hockey team anymore. But I'm grateful to be part of this announcement of this amazing partnership between Quinnipiac and Hartford HealthCare, two organizations that have greatly impacted who I am today. So just a little about myself. Growing up, I've always been surrounded by healthcare professionals. Like as a little kid, I played stuffed animal, like doctor, and I looked up to my father who works in the healthcare field. So that was a big impact on my decision to go into nursing. So when choosing a school, I fell in love with Quinnipiac. I toured it, I thought it was beautiful. I came here to the North Haven campus. I was impressed with all the labs, everything it had to offer. So it didn't take much for me to know that Quinnipiac would prepare me for my future endeavors as a nurse. Quinnipiac School of Nursing taught me to be confident in my skills, be a leader, facilitate change, with not only my patients, but within the community surrounding it, which I love about it. And then so I started the summer after my freshman year here at Quinnipiac as an OR aide at the Bone and Joint Institute, like Jeffrey said. And going into it, I was really nervous because I had never been in a healthcare setting before, never worked in the hospital at all, and it was an OR, so it was even more stressful, everything's sterile. I need to not touch anything. But it was an awesome experience. I decided to continue working the following summer. And then following those 2 years of being an OR aide, I got accepted into the OR Nurse Fellowship Program through Hartford HealthCare. And in this fellowship, I was assigned to, at first we got to get all the ins and outs of the OR, because as an OR aide, I was mostly on the outside and cleaned up after they were all done making a mess. So I got to know what I actually could do when I was in the OR. And then I got to tour all of the different ORs within the Hartford Hospital, and I got put into West Hartford Surgery Center, which was a different experience again, because I got to go behind the window. I always used to peek through. When I was an OR aide, I was peeking through all the windows of the surgeries because I wanted to see them so bad, but I was locked out. So participating in the OR Summer Fellowship was extremely rewarding. I met a lot of new friends from different schools. I met new friends from this school even that I haven't met before. Made many connections with the OR staff, and if I could do it again, I would. So as I reflect on my time in the OR, all my clinical experiences I've had through Quinnipiac, I hope to stay in the OR or start off on the floor somewhere in the ICU. I'm still thinking about that. It's been racking my brain all break. But either way, I'm excited to start my next chapter in the nursing profession. And I believe this partnership is mutually beneficial between the Quinnipiac community and the future of Hartford HealthCare, and will provide students like me with valuable long-term experiences. Thank you.
Thank you, Jillian. We greatly appreciate you sharing your story in particular, because I think it's a great reminder of how marrying the hands-on experience you get outside the classroom with your personal passions can result in a sort of this clarity on what your career path is. And so sharing that story is really helpful, because I think it shows the trajectory that this partnership will have. We're going to take a brief moment now to do a signing of the agreement between Hartford HealthCare and Quinnipiac to memorialize the beginning of this great new relationship. If Judy and Jeff, if you would like to sign the document there that's on the table there before you. Perfect. Thank you very much. So at this moment, we'll open up for any questions that members of the media may have for Jillian, Judy, or Jeff today. Back here. Maybe you can just identify yourself and the organization you're with, please.
Steve Singer, the Hartford Current. Can you give some specificity about the $5 million, how it will be spent over the next 5 years? And also, in terms of workforce, can you talk about issues concerning burnout and frustration a lot of healthcare workers have had during COVID and what may continue? Thanks.
Certainly. Thank you. So we're going to work together and plan how we're going to use the $5 million with greater specificity. But the areas that generic, that we know that we're going to likely choose to invest in are simulation. So these are the necessary capacity to build a simulation center here, the minority and underrepresented nurses and other allied health professions that we're going to create pathways and scholarships for, so we can strengthen the diversity of our workforce to be more representative of the communities we serve. We're going to use it to help strengthen the size and scope of the programs here at Quinnipiac, so that they can expand to actually train and educate more students that then strengthen our pipeline, as we go forward. So together we'll work with the president and her team to figure out the best and most specific ways that those investments really can stimulate the workforce, create the workforce of the future, and allow Quinnipiac to continue to advance its efforts on being a world-class health sciences university, and our capacity for the state of Connecticut as a whole, to ensure that we have the right people in Connecticut to take care of us all in the future. And maybe speak to that and I'll answer the question around the burnout, maybe perhaps right after.
Well, we're very grateful for the philanthropy of Hartford HealthCare and Jeff's vision for how this generosity could impact Quinnipiac. Obviously, in the case of such generosity, we work together on what are the best places to mutually satisfy our overarching goals. And I think Jeff mentioned a few of those, but this will be a collaboration. And as Jeff said, we see this partnership as just at the basement level here. It will grow in different directions with many impacts across the workforce, across the state, and across our educational programs.
Yeah, the second half of your question around provider burnout, we're doing everything possible to address that issue now, and it's something that's really critical always. Fortunately, a number of years ago, we created a division within Hartford HealthCare. It's led by a physician, Dr. Sharon Kiley, who's a leader within the state and beyond on provider burnout. So we have many programs, many services, different ways to support our colleagues at any level we can think of, to try to make they're heroes. Right? People working on the front lines of healthcare are doing exceptional work always when we need them most. And we have to, in this pandemic, but truthfully before and after, continue to figure out more ways to support all the people who work within healthcare. I'm really delighted that we have a very focused team and leaders who make their full-time job, this very specific issue. So building a bigger, broader workforce into the future, a well-trained workforce, is ultimately what's going to be most critical as we get into the future, which is why we have to think differently and come up with new ways like this to solve historic challenges.
And I wanted to just pick up on what Jeff said. I mean, the most obvious way is to have more nurses, more physical therapists, more doctors, more to address the burnout. And Quinnipiac already launched an accelerated nursing, an additional cohort, an accelerated nursing program this January. And we hope that will help Hartford HealthCare and our other partners all across the state.
How much stress is it putting on the workforce in terms of how many people you have to replace in addition to just hiring new people to keep up with the aging population and all those other issues? That's what I'm curious about.
Yeah, that's why we're creating this partnership for exactly what's underneath kind of that question, which is we have to figure out more ways to retain the students who are in Connecticut today. So when they graduate, they stay in Connecticut. And we have to figure out ways to train more students. And to the extent we're able to do that, we're going to build a bigger, broader, more well-trained, well-credentialed, more ready workforce. And it's, we're blessed in the state to have a university like Quinnipiac with these resources and a health system like ours that has the adaptive nature that can create these experiential opportunities. Please, other questions?
Any other questions? At front here.
Megan Friedman with New Register. I was wondering if you're able to put any numbers on how much you might expand the spots in your medical school, nursing school.
We haven't made any decisions on that yet. I mean, in the nursing and health sciences field, we have already started expanding there. Any kind of expansion in the medical school is done in collaboration, not just with our partners, but also with the accrediting body that we will be consulting with.
And you also alluded to working with non-healthcare fields within Quinnipiac, the law school, business. Can you talk a little bit more about what that would look like?
Sure, I'll give one really great example. So we have a program that's been in Hartford HealthCare for at least 12 plus years, where we train administrative fellows. We bring people here to Connecticut from top universities around the country who spend a year working in a training program under leadership across Hartford HealthCare. And then ultimately many of those people are retained and help populate our future leaders. We're going to partner in this example with Quinnipiac so that within the School of Business and with their other health sciences schools, that we create pathways to identify high potential students here that can then enter that fellowship. And there's numerous examples, whether it's the law school, whether it's the engineering school, where we have so many needs within our workforce to help us transform healthcare, that if we get involved earlier with the students while they're in the educational programs, working together with the faculty on curriculum and so forth, and getting these students involved with us experientially, we're going to be able to, one, retain more people to stay in Connecticut, and secondly, meet the needs. We need people who have different skill sets in the future and who have different capacities to help us transform healthcare. And working with Quinnipiac, we're going to do that.
Let me give you just a couple of examples. One of the biggest issues during COVID was around logistics, supply chain management, getting the stuff that you need, when you need it, and where you need it. We have very advanced programs in supply chain management and logistics. The data analytics is key to creating greater efficiencies in healthcare, and we have a data analytics program, actually more than one program. We have a healthcare compliance certificate. Compliance is such a big field, and working together with Hartford HealthCare subject matter experts, we will continue to hone these programs around exactly where, and to use a hockey analogy again, exactly where the puck is headed. And so we really believe that this improves not just the size of the pipeline, but the relevance and the cutting edge training of our graduates who will be entering these fields to benefit, of course, Hartford HealthCare, but the entire state and frankly the nation.
I think, does he have a question over here? Had your hand up? No?
Oh, yeah. Can you tell me what the status of the lawsuit is against Hartford HealthCare by Trinity Health?
Yeah, I hope you understand, we can't speak about ongoing litigation. We're here to talk about this partnership, which is truly, it's a landmark. You know, as the president described, it's going to do great things for the state.
There was a question over here.
Yeah, other questions from the group before we finish up?
Just one quick clarification. You said the student health center will now go in the new rec center.
It will, and will be managed by Hartford HealthCare, and we expect it to be very high quality, expanded services. We're very excited about this partnership and the services it will deliver.
And who has been managing it?
It's being managed by Quinnipiac, and all of the employees will transfer over to Hartford HealthCare, and we're very excited about the possibilities brought by this new partnership.
Thank you.
Thank you. I hope you visit the new Rec and Wellness Center come this summer.
Well, if there are no further questions, we can adjourn. And again, just appreciate everyone for taking the time to join us here today for this announcement. Have a great afternoon, everyone.